Hey guys, welcome to Tea Talk. It's Tuesday, July 30th, and our topic for tonight is transitional care management. So, again, welcome to the channel and to the live stream if you're new. And if you're returning, welcome back. We had taken a little bit of a break due to travel and illness, and so this is our second week rolling back. So, I'm still from a different location other than the typical office setting. But to be honest, I'm kind of digging the vibe of this location and the lighting. I don't know. I like the lighting better, but it is difficult to get lighting right in an office. So just a reminder, guys, if you want to send in some requests for topics or you have a specific question, one way of reaching us is through email, ttalk@stalkinghorsellc.com. So you could email us your question, concern, topic idea, and we will address it on Tea Talk. Also, we are on social media. So please make sure you like and subscribe to this channel. Give a thumbs up to any of the videos that you like. You can also make comments after the fact on the videos. So if you end up having a question after, don't feel like emailing, you can always put in a message or something in the chat on the video and we will see it. We're on Facebook, Instagram, and LinkedIn also. So please follow us on those platforms also. And then our website is stalkinghorsellc.com. And on our website, we have additional resources, webinars. We also have a section for Tea Talk where some of the documents that we've referenced in some of these sessions are up, or if someone requests that we add something to it, we do that there. So it's like a little library of topics that we've covered on Tea Talk. And you can find a lot of that information, but not all of it, on the YouTube channel. So some of the information that's on the website you cannot get, because through YouTube, you can't really upload like a document. So like, for example, tonight, again, our topic is transitional care management, and I have a document that we're going to walk through. And so this document, I can't really attach it on YouTube, but I can put it on our website. So if someone requests that, we make them available there. We make those documents available there that you can access them easily. So I'm going to go ahead and see if anybody has made any comments. I see we've got a couple people joining. Don't forget also in the comments here on YouTube, make sure you let me know who you are and where you're from so that I can share on the screen. I can sometimes tell how many people are in the room, but I can't tell who you are unless you make a comment. So I see we've got Ricky from Vegas. Welcome back. Thank you. One of our Tea Talk vets. And also Aline from Florida, one of our vets. And we've got Chantilly tonight. So hi, Chantilly. Yes, you're in Florida too. Hello, hello. Nice to have you on this evening. This topic also, the transitional care management, just to add, we did another video, I think it was a couple years ago, just on the regular YouTube channel. And I think that like if you search YouTube for videos, just like the videos that are like recorded, I believe are like showing up. So these lives are in a separate section, which I'm kind of finding that to be a little bit frustrating, because I'm hoping, fingers crossed, that if somebody is searching for information like on transitional care management, also known as TCM visits, that they're able to see this video come up in the search on YouTube. So hopefully that is the case. If not, make sure you share with your friends or colleagues if they're looking for additional information on the topic. So for tonight, I decided to skip tea because I don't know what I have here that's decaffeinated besides sleepy time tea. And if I drank the sleepy time tea, I could fall asleep on you. So I have two drink options. I have Sprite and Smart Water. And funny enough, people that work with me and my family make fun of me because I love having drink options. So typically, I have about three drinks available. My magic number is three. So usually it's like a hot drink, a cold drink, and then something maybe a little flavorful. And I don't know why. I just like having options, and I sip on all of my drinks throughout the day. Yeah, so Aline says, don't fall asleep. I'll try not to, but I'll tell you, some of the paperwork or, booklets and information that comes across for coding, it definitely could help you fall asleep. So if you're having some insomnia and you print out one of these documents and you just read it at night, you may find that it's better than counting sheep. Oh, so Ricky, you have water. Oh, wait, it's wine. A miracle. Funny. Very funny. Is it your Chianti again? Uh, you get some, you definitely like outdo us with your fancy drinks. So yeah, I'm pretty basic. Oh, but I do have some M&Ms for a little snack. So we'll see. This topic's going to get interesting. Oh, yeah, let's see. So Malbec, huh? So nice. I don't know. I don't know if I've ever had that. Is that dry? Is it sweet? What is that? See what you have to say about that. So before I jump into actually pulling up the document, please let me know in the comments if you have any specific things you want to make sure I answer or cover in regard to transitional care management. But to give you a background story, transitional care management is actually one of the services that is being covered now that I'm really a supporter of and think that it's very important to have available and for providers to perform for their patient population. It's similar to like what they're doing now, what Medicare has been doing now with social determinants of health. And so I'll kind of explain a little bit more about why I think it's important. And I once we like dig into it, I think you guys will all agree and see why it's important. So we've got the wine answer. Let's see. So medium body, again, that's very fancy. I don't know wine terminology. So you say not too dry. Okay. All right. Well, maybe I'll have to try that sometime. Maybe we'll do like another show for wine. It's to go over those coding cases that drive you to drink, right? So this would be a show dedicated to that. Okay, so for transitional care management, typically this is just covered by Medicare, Medicare Advantage, and it is important for people that are transitioning from one type of how do I want to put it? Like one area to another. So from inpatient to outpatient. And I'll give you an example. So if you have any family that's older or aging, anybody in the Medicare population, but particularly if you think of someone that maybe doesn't have like the best memory or maybe has a lot of medications, very complicated health, maybe a few chronic conditions, and trying to keep all that stuff managed is difficult enough, like when they're at home. But when someone gets admitted, let's say into the hospital, we'll just keep it easy breezy for now. When they go into the hospital, many times the hospital ends up making changes to medications or dosages. They may inform the patient that they need to have some further testing done on an outpatient basis, or that they need to have a visit with a specific specialist, or follow up in so many weeks for labs. So there's a lot of different instructions that can be delivered during that stay. And that information doesn't always properly get communicated, number one, between providers, and then number two, in a way that the patient understands and feels confident. And there's no one to kind of check on them from the hospital, like once they transition to home. So transitional care management is essentially a visit that, well, it starts out as one visit, but it's services that cover like a month-long period. To be specific, I think it's like 29 days. Yes, 29 days. So it covers 29 days where the doctor's office that performs the service is helping the patient transition from that inpatient stay to being outpatient. And so it would be start off with a visit where they would go over the hospital stay, things like I said, any testing that's needed, medication reconciliation, which is super important. It's been found that a lot of patients end up being readmitted into the hospital due to issues with medication, and taking them properly, or obtaining them, or something was switched, but maybe they didn't switch over to that. So it starts off as a visit with a doctor, a provider, and it goes over what happened during the stay and make sure that the patient is on the right track and that they're stable, and that they're improving. Or do they need to maybe go back to the hospital? Are they not doing well? So again, it's to help them in that transitional period. So you could see why it would be super, super helpful for especially our Medicare population. So commercial insurance companies, it's up to them if you have a commercial plan as to whether or not they cover it. Mostly it's covered by Medicare and Medicare Advantage plans. So we'll jump into looking at an MLN booklet here in a minute, but Ricky has a great one. So wind down the week. So yeah, if we're gonna do a show about these coding scenarios that drive us to drink, that's a perfect name. Wind down the week. Wow. All right. Well, maybe you can co-host. We'll see. Or maybe I'll co-host. It'll be your show and I'll co-host. How about that? So, all right. So with these Medicare Advantage services like transitional care management, obviously one of the best places to start if you have questions is cms.gov. So if you go to cms.gov, that website, a search bar will come up, and it's like, pretty much like a top middle-ish of the page, and you just go into that search bar and you would just type in transitional care management, search, and literally one of the first things that shows up is a Medicare Learning Network booklet, and the booklet will break down transitional care management services. So I'm going to share that booklet with you guys here in a second. And we're going to walk through it. So let me try to share here. If you're just joining, make sure you let us know in the comments who you are and where you're from. We'd love to hear any questions that you have and for you to become a part of the group here. So let's see. Let me get this. Okay, let me know if this is a little too small. I tried to make it big enough, but not too big. So this is literally the booklet that will come up, the MLN booklet. It might be the first item that shows up. And these booklets are fantastic from Medicare. And they all have a table of contents, and they update them pretty much annually. This one, though, the last time was in May of 2023, so it's going to be due for an update. But there were no substantive content updates from prior. So literally, it's going to break down a lot of things that you need to know, pretty much almost anything that you need to know about transitional care management. So I do highly recommend that you take a look on the cms.gov website. And if you're a provider, it is going to be a little bit of a read for you. That one, it's not too bad though. That one is 13 pages, but it will give you a really comprehensive overview of what it is and how it works. It doesn't necessarily give you all the coding information, so we will cover that also tonight, but it helps to really clear up some of the technical questions that many providers have. If you're a coder, I recommend that you save it. So you can save it as a PDF, put it in your files, or you can print it. A lot of us choose to print the documents and then put them in the sleeves that are transparent, so it's like a protector. And then you have that in a booklet, usually like we put them in like 3-ring binders, and it's helpful. But the only thing about that is you would want to replace them, obviously, as soon as they get updated to make sure you have the most up-to-date information. So it looks like Chansley, yes, you use them all the time for TCM requirements. Great resource. Absolutely. I think that it's a fantastic resource to use. And it helps with reminding us of things. And sometimes you come across unexpected situations and you're just like, let me try to remember what that specific rule is about that. Because there's some timing guidance in here with TCMs so that you need to follow. Hi, Lindsay. Looks like you've joined. You're late. Just got power back a couple minutes ago. Bad storm rolled through. Okay. No wonder why I saw Ricky have these little emojis come up. And yeah, so hi, Lindsay. Welcome. Thanks for joining us again. So with transitional care management, so Medicare may cover those services during a 30-day period that begins when a physician discharges a Medicare patient from an inpatient stay and continues for the next 29 days. So a total of 30 days, but after the visit happens, you've got 29 days. So they do help, again, it's sort of like goes in with the name. It helps the patient transition back to being like an outpatient or being in the community setting after a stay at certain facility types. So really the services include supporting the patient in that transition. We don't want the patient to have a service gap, so it helps to kind of bridge them over and make sure that they're getting those services that they need. Most of the time it is performed by a primary care physician, but that's not a requirement. So specialists can actually perform TCMs also. So it really kind of depends on the patient and who is really responsible for a lot of their care, or maybe even the reason that they were discharged. So it would be the professional taking responsibility for the patient's care. Now, another interesting bullet they have is moderate or high complexity medical decision-making for patients with medical or psychosocial problems. So I'm going to stop there for a minute and just chit chat with you guys. That's one of the biggest things that providers lose, is that their documentation still essentially needs to be leveled from the perspective that their medical decision making needs to meet a moderate or high level of complexity in order to code and bill for a transitional care management service. So, suppose a patient was discharged and they come in for what the provider thinks is a transitional care service, but the documentation only supports a low level of medical decision making. Then that service would not be able to be coded as transitional care management service. It would actually just default to a regular evaluation and management office visit service. So that would be like the 99212 through 99215 instead of either the 99495 or the 99496. So leveling is still required. That decision making has to be moderate or high complexity. So the inpatient requirement is also a question that's commonly asked. So, what types of inpatient stays, like what qualifies? Is it just hospital? Is it other facilities? And so, their workbook here actually covers that. So, the settings are listed here in these bullets that the patient can be discharged from where it's applicable. So, inpatient acute care hospital, inpatient psychiatric hospital, inpatient rehab facility, long-term care hospital, skilled nursing facility. That's one that's asked about a lot. Hospital outpatient observation or partial hospitalization. That's also another one. And I'll be honest with you guys, that's one that I've caught myself a few times like, wait a minute, is that on the list? Let me go back and just double check. Or partial hospitalization at a community mental health center. So any of those locations from which the patient is discharged would then set the stage essentially for the transitional care management service to be performed, if it is performed. So when they're discharged, the patient actually has to return to what they call the community setting. So that could be their home, or it could be a group home or a boarding house or a nursing facility or an assisted living facility. But it does need to be, again, the community setting that they return to. So the next thing too is providers a lot of times will say, well, who can provide the transitional care management service? So is it just an MD? What about my RNs? Because some RNs can do some work with annual wellness visits. So can they do TCMs? What about PAs and nurse practitioners? So they actually, on the next page, address that. So it's definitely not registered nurses, but physicians of any specialty, as I mentioned before, again, typically this is provided by primary care physicians or, general practitioners, but it's available. The codes are available for any specialty. So then non-physician practitioners that are allowed to bill for the service would be certified nurse midwives, clinical nurse specialists, nurse practitioners, and physician's assistants. So that is something to think about also. It is truly like an evaluation and management, like a regular office visit, like the same types of requirements are there from the provider perspective. So it's not something that you can just set up that doesn't need to be have an official assessment. And it makes sense because if you think about the requirement for the medical decision making to be of at least moderate or high complexity, that makes sense because we can't have other provider types making those, like performing an assessment, diagnosing, creating those plans. So that doesn't happen. So it does make sense when you think about it, the provider type section. So a practice may have incident to set up. They do kind of briefly talk about that and supervision, but I don't want to dig into that right now because that's a whole nother tea talk. Because when we talk about incident to, and that's obviously just for the office setting, that gets crazy. So there's all kinds of rules behind incident to, and whether or not the TCM would work honestly depends on what's going on with the patient in that situation. But it is technically allowed. But yeah, incident to is a nightmare to audit. I can tell you that. And yeah, Lindsay, looks like you agree. Yeah, it's a bear. It's a bear. So um, typically it would be, again, those provider types are able to provide that service. The medical decision making still needs to be leveled because it needs to be at least of moderate complexity. So moderate or high would allow for use of the transitional care management codes. And then there's another requirement that typically gets practices in a little bit of a bind. So when a patient is discharged, they don't just somehow automatically have an appointment set up, right? So someone has to be contacting the patient to get an appointment set up for the transitional care management. So in this booklet, they call that interactive contact. And so the patient needs to be hearing from you. And so let's talk about that. So you or clinical staff under your direction as the provider must contact the patient or their caregiver by phone, email, or face-to-face within 2 business days after the patient's discharge from the inpatient or partial hospitalization setting. So I'm going to kind of come back here to say 2 business days. So the business days is important because there's another time frame setting for this coding that has to do with when the appointment actually occurs, when the TCM appointment occurs. But you have to make contact with them within 2 business days of their discharge. So if there's a holiday in there that everybody's closed, that's not a business day, but you do need to make sure that it's within 2 business days, and there needs to be documentation of that contact. If there's no documentation, you have no proof that that interactive contact actually occurred. So making sure that that documentation gets in there and that it's clear that it was within the 2 business days is super important. Many softwares have, like phone notes or other logs where you can put that documentation in there that is separate from, it doesn't have to be like an office visit note, right? So I can't even think of a software that doesn't have that at this point. But getting documentation there of that contact that's within 2 business days is important in order for you to have that visit covered. So the clinical staff, it says, can do that under your direction, but it means someone who's supervised by the physician or the qualified healthcare professional. And they're allowed by law to help and assist in a specialized professional service, but they don't technically report that service. So that interactive contact essentially must be by someone, by clinical staff, who can address the patient's status and needs beyond scheduling follow-up care. So they need to be able to know, what's going on with them. If there's an emergent situation, obviously, we need to be able to have that taken care of, let the provider know. And the next thing that typically happens is a lot of practices say, well, what if we tried within the 2 business days to contact them, but we couldn't reach them. We couldn't reach them until like the 3rd or the 4th day. So they do address that. Let me show you that. So here they say that you may report the service if you make 2 or more unsuccessful separate contact attempts in a timely manner, and if you meet the other service requirements, including a timely face-to-face visit. So we'll get to that face-to-face visit next, but you must document your attempts in the patient's medical record and continue trying to contact the patient until you're successful. So if you say that you're attempting to contact them, you must document the attempts to contact. After that, I see we got a question here from Ricky. Does the patient have to visit face-to-face? So the interactive contact is to check on the status of the patient, and then they also schedule the face-to-face visit at that time. So they do need a face-to-face visit, because the interactive contact in itself does not qualify you to bill for a transitional care management service, because again, many times that's not done by a billing provider. So you can't bill for that service anyway. That's just essentially checking in with the patient and getting the visit scheduled. After they get them scheduled, when they have that visit, that's where then we need to look at the level of the medical decision making, and then we'd see, does it qualify for the transitional care management. So the patient first, again, they get discharged, then we need to have this interactive contact and set up the face-to-face. Now, this is a telehealth code, just to make that clear also. But the face-to-face, you would need the video. That's still considered face-to-face. So it could be via telehealth, or it could be in person. But either way, it has to be face-to-face. So Ricky is really on fire tonight. So he's asking, how long after initial contact does the patient have to come into the office? Great question. So depending on the code, depends on that time frame. So we're going to get to that here in just a second. I'm going to show you guys the rules on that. So they're going to get the patient scheduled right during this contact, during this call. So the patient being just discharged from one of those inpatient type facilities, you're going to probably automatically just assume and understand that this isn't something that can wait a long time. I know some of the practices that you call, sometimes you can't get in for 3 weeks, a month. It can get crazy, right? Especially for some of the specialists. So you actually need to get them the visits scheduled. The maximum time frame that it could be is 14 calendar days. And so I want to make that distinction there. So the phone call to the patient has to be within 2 business days to check on their status and get them scheduled. But the scheduling of the visit has to be within 14 calendar days of discharge. So again, and that's 14 calendar days of discharge from the facility setting. So it's not 14 days from the call, from the contact. It's 14 days from the discharge, and it's calendar days. So they don't care about holidays. You still count them. It has to be calendar days, and the longest time that you could go is 14. So let me kind of share their information on that. So the 2 codes, and we'll go into the coding in some more detail here in a few minutes, but the 2 codes that the transitional care management services kind of break down into is 99495, which, if you read the description, you have to make that communication or contact with the patient within 2 business days of discharge. The medical decision making has to be at least a moderate level, and the visit has to be within 14 calendar days of discharge. So there's essentially 3 pieces of criteria there. Initial contact within 2 business days of discharge, the medical decision making documented during the visit when they actually have the face-to-face visit has to be of at least moderate level medical decision making. And then it has to be within 14 calendar days of discharge. So again, that's the 99495. And you would be surprised at what I was just about to say, that Lindsay stole the words from my mouth. Holidays always get you on that one, and they do. And it's not necessarily that it gets the coder, but it a lot of times gets the practice, because the staff that's working in the practice that's trying to understand the rules around transitional care management, they'll get the business days for the initial contact completely confused with calendar days for the visit, right? So that's super easy to get mixed up. And many practices will actually schedule the appointment as a transitional care management or TCM visit. So when they go into the EMR, and then let's say that they've made that direct contact with the patient, let's say the day after they get discharged, they get them on the phone, they talk to them, the patient's doing okay, but they need to get in for the appointment. At that point, if they're not careful, they could be counting calendar days or business days, sorry, instead of calendar days. So if there's a holiday or something in between there, you'd be surprised. But when they schedule the actual visit, a lot of times there's appointment types that will come up, and they'll select a transitional care management visit. So at the end of the month, when you have practices that are run like pretty well-oiled machines, they'll run reports where they have the visit type marked as transitional care management, and then they want to see the code line up with that service. So if they see like, oh, we scheduled this as a transitional care management service, but yet our coding and billing team, like, they reported this as a regular office visit. Why? This was in, 14 business days. Well, those holidays get them. They get them a lot. So it also can be something that the coding side forgets, but a lot of times it's something that the office staff forgets. And then the patient gets scheduled and it's past that threshold. So then if we looked at, because we know there's 2 transitional care management codes, if we look at the next one, 99496, so that says TCM services, the same requirement with 2 business days of discharge, right? But the difference here is it requires a high level of medical decision making. Okay, this one is at least moderate. This is at least moderate, right? And 14 calendar days. This is required to be a high level of medical decision making and has to be within 7 calendar days of discharge. So the 99496 is much more uncommon, I would say. So that would be for a patient that is complex, right? The complicated situation, because their medical decision making would have to meet that high level, and the visit would have to have been scheduled, that face-to-face, within 7 calendar days of discharge. So those are like the tricky things about the coding aspect of it. And then from the provider's end, it also can be a little bit tricky and cumbersome. And I'll give you guys an example. I actually was on the phone today with a client, and we noticed that they sometimes have a delay in finishing some of their TCM visits. And the response that the coding team gets is that they're waiting on some information from the hospital. Like they may be waiting on tests or notes that providers had performed during that inpatient stay. So it's like, okay, well, what does that exactly have to do with that day? Like, why they could finish the documentation, because if they had a face-to-face with the patient, they have already completed that service. So from the coding end, you're kind of like, okay, but you're not going to change like what was done. So what difference does that make? But the challenge for the providers is that, again, you have to remember that this transitional care management service period technically runs for 30 days, but 29 days after, that initial day. So you've got the 29 days there. And so the provider is accepting responsibility for that transition in care. And many times the documentation on the hospital side is delayed, and those providers don't want to miss something that occurred during that stay that may need to be followed up on. So come to find out, they were trying to use that as essentially like a reminder, because it stays on their list for them to go back to the staff and say, hey, I'm still waiting on that pathology report or that MRI report that happened for this patient's stay, and I need to review that, because if we need to act on it, I need to get a hold of the patient and have that taken care of. Still included in that service window, but if they don't have all of the documentation from the inpatient stay to review, that gets challenging. So obviously, we'd love for there to be a better way, another tool or function within the software that the providers might be able to use to help them with that. So I think that might be one of the providers' struggles, and one of the things they probably don't like too much about a lot of the current software is that, when you're performing additional services like TCM, sometimes the software isn't super friendly, where you can kind of have something like almost like a tickler, right, to remind you or to flag an account to make sure that it gets completed so that the provider isn't missing something on the patient. It is actually a little bit scary, like how many times something will come back abnormal that the hospital team never mentioned to the patient. It could be several reasons why, like that, maybe again, that documentation wasn't completed and then they were already discharged. So then they're not following up with the patient after the fact. But then whoever is providing the transitional care management service needs to make sure that they're covering that. So the provider's work is basically reviewing discharge information, like the discharge summary or any kind of community care documents that might be in there. Anything that the patient may need, again, from a follow-up perspective, any additional testing, seeing any specialists. Also, they may need to interact with or communicate to other providers or other specialties to get the patient what they need. There may be a certain supply or service, or even getting them in for a visit maybe more urgently than they may be able to get in on their own. We know that sometimes, like, if you're a provider, from provider to provider, if they one calls to speak to another about getting a patient in, they typically prioritize that versus the patient calling themselves to get in for a specialty appointment. It's just the way of the beast, the way that it goes. There also may need to be some time spent by the provider educating family or a caregiver in regard to the plan for the patient and what needs to be done. Again, referrals, they may need to schedule some community care services for the patient or sign them up for some additional types of services that they may need from social aspect or again, just connecting them with the right company who can actually even sometimes just dispense some DME, a durable medical equipment. I know one of the crazy things too is kind of on the side, but just as an example, sometimes there's supplies for like CPAPs can be very, very obnoxious for the patient to be able to get to the right place because sometimes the facilities change and then Medicare is not covering it under, this one equipment provider anymore. Now it's a different one and it can be a real nightmare for the patient. So making sure that all that stuff gets straightened out is a part of it also. And again, just remember that it actually can be done via telehealth. It is a telehealth code. Now, there are some services that you may do in conjunction or what they say, or concurrent is really the better way of putting it, concurrently with TCM. So they on this document, they actually have a list. So instead of me trying to ramble some off, they actually have a list of TCM concurrent billing. And you'd be surprised because there used to be some restrictions between billing TCM visit within a month and some other services. And so they're, now listing out some of the other services to make it more clear that, hey, you can still bill these both at the same time or within the same month. One of the more common ones that was in the past not allowed and now is chronic care management services. So there was an old rule that if they had chronic care management services, you couldn't bill TCM the same month, but that is no longer the case. So you can have either complex or the regular chronic care management services and TCM. So you can bill those concurrently. One other thing that I think is super important to point out is I did mention how one of the big points of discussion during the visits is medication reconciliation, because many times when patients are in, their medications get changed. And then when they come out, their regular provider they need to be reviewing what the hospital had discharged the patient like with what they were taking and the dosage and all of that and go over that with the patient. I've actually seen where the hospital tried to make some changes or they documented that they made certain changes that made absolutely no sense. And then the provider had to turn around and then make an additional change for the patient because the change that was written in the documentation of the hospital was not correct. Not saying it happens often, but it does happen. Sometimes it's a documentation error. And ironically, not to throw any places under the bus, but there's, some hospitals that do have a lot of students now. And I have noticed that some that have a lot of nursing students tend to have a little bit more problem with the documentation because the nurses in the hospital end up putting in a lot of orders for the providers. And one of the things that they deal with is medications. And I've seen before where they've actually wrote in for the patient to stop their high blood pressure medication completely. when that never should have been the case because the patient was admitted anyway with hypertensive crisis. So it just didn't make any sense. But that can be really confusing for a patient in general, and then also a patient who maybe has no experience in the healthcare field whatsoever. So they're just going to do whatever they're told and maybe not question it, which again can be lead to a very bad result for the patient and maybe another hospitalization. So performing that medication reconciliation is actually so important that many of the Medicare Advantage plans have an additional code for quality measures. And you guys type it into the comments if you remember what it is. I'm going to see if anybody gets it, because I know there's a couple people on here that we've had conversation about it. So that medication reconciliation quality measure code, if you know it, type it into the comments and we'll talk about it in a minute. Oh man, Lindsay with the quick draw, that is correct. So it is the 1111F. And Chantilly, you came right in after Lindsay. Great job, guys. Yes. So that oh, and now Aline, great job. That is known to be super important for quality measures. And so they want that CPT2 code or quality measure code reported if there's documentation of medication reconciliation being performed during that transitional care management. And in addition to that, for any hospital follow-up. So suppose the patient came in after a hospital visit. If they're there for a hospital follow-up and that medication reconciliation is performed, they want that code reported. And it makes sense because, again, they've recognized that many patients end up back in the hospital or with really bad outcomes because something was wrong with their medication, with either what they were instructed to do or what they understood. So it's super important for that medication reconciliation to be performed and documented that it was done. So just having a list of the medications in the note, so for the providers, just having a list of the meds is not acceptable. You have to document that you performed the medication reconciliation from the discharge to the current visit. You discussed it with the patient, that you actually performed that reconciliation and gave that instruction. So it's medication reconciliation and management technically. So that's a super important piece of the TCM. That's really what one of the big things that they're looking for. And again, that's even just with hospital follow-ups, because that's just one of the biggest things, because the hospitals don't see the patient, on a continual basis. They're not managing them, across time span. That's, well, technically not what we're supposed to be using the hospital for, right? So the providers that are working as a team to manage the patient really should be reconciling those, especially when the patient just came from the hospital. And many offices may even do it when a patient comes back from a specialty visit, so primary care. I mean, many offices even started creating policies where you needed to bring all your medications with you to a visit. And again, a lot of those are offices that serve the Medicare population. So yeah, that's, again, a really important piece. So you guys have really been awesome at participating today. I don't know if anyone has any additional questions. I'm trying to think if we've covered everything. I know that I don't know what everyone on here uses, but I've mentioned before that I use Codify a lot. They have some great information on Codify for both of these TCM codes. And so that's also an additional source. I'm sure Encoder has some great information also. I just think it's important to, again, kind of have something in front of you to remember those key pieces of information. I'm going to go back to that page and share with you guys. And let me just make sure I've got this highlighted. So let me share that part of the screen again. So again, for our codes here, let me make it a little bit bigger. So for the 99495, we need to have communication within 2 business days of discharge, right? And the face-to-face visit documentation for the transitional care management service has to at least have a moderate level of medical decision making for the 99495. And the visit needs to occur within 14 calendar days of discharge. So remember, that's calendar days versus business days. And then for the 99496, we're still looking at communication into business days of discharge. And the 2 differences is that the medical decision making for the 96 code needs to be of high level, and the visit, the face-to-face visit, needs to occur within 7 calendar days. And again, don't confuse calendar days with business days. These elements, handy is awesome. And then even if you're not a coder, if you're working in a practice and you're scheduling, or you're part of the team that is making contact with the patient, it's important to understand that, because again, if you schedule them outside of the 14 calendar days, you will not be able to bill for either one of those codes at all. It would end up being, 99212 through 99215. You would not be able to bill either one of those TCMs. And then for providers, again, making sure your documentation is complete, that the complexity of care that you've provided is clear, because if you do not meet that moderate or high level, it does default to a regular office visit, which is fine, but just, make sure that you understand that, so that if you're saying, oh, well, we had, 15 TCM visits scheduled, how come only, 13 of them were billed that way? So there's different things that could impact that, whether it be that the contact wasn't initial contact wasn't within 2 business days, the visit wasn't within either 7 or 14 calendar days, or if the medical decision making in the documentation doesn't support at least a moderate level. It could drop down to an evaluation and management 99212 through 99215 for the established patients. I think I did neglect to say, let me see if I can find it here in their documentation. I think that one of the questions, let's see, I'll find it here. I don't see any additional questions, but I thought I saw something in this document in regard to questions about the other, like, office visit codes, but I'm not seeing it now, and nobody's asked it. So, hey, could have just been a dream. I don't know. So, okay, do you guys have any questions about TCM? So speak now or hold your peace until after, and then you're going to have to either email us or post a comment on the video, or reach out to us from our website. So remember, our website, stalkinghorsellc.com, and our email for T-Talk is ttalk@stalkinghorsellc.com. So feel free to reach out. And again, we will take any requests for future T-Talk episodes. All right. So I think we've done a pretty good job at covering them overall. I appreciate you guys joining tonight, and hope to see you next week. And again, feel free to reach out to us or comment. Make sure you give a thumbs up to this episode if you enjoyed the information. I think we did a pretty comprehensive overview of TCM. So again, thank you so very much for joining. And as always, we will see you next Tuesday.